Welcome to Bronson Cardiac Rehab, Risk Factors and Exercise. Cardiac risk factors come in two different categories. So we have our controllable risk factors, which are the ones we will be talking in detail about today. These are the things that we do have some ability to control through lifestyle modification and other means. And then we have risk factors that we cannot control. So let's start by listing off some of the controllable risk factors. Weight, smoking, physical inactivity, cholesterol levels, high blood pressure or hypertension, diabetes, stress, anxiety, depression, anger. To a degree, we can control those things or have some influence on them. And then the factors that we cannot control are things like family history, genetics, gender, and age. So let's dive a little deeper into some specifics on these controllable risk factors. Care, we look at exercise as medicine. So you can see this statement here, exercise has a positive effect on many of our cardiac risk factor areas. And today we will explore how exercise. The first risk factor we'll talk about today is weight. Being overweight increases our risk for heart problems, cardiovascular disease, as it does put more stress on our heart. Some of the factors that can affect weight are things like family history, diet, medications we're taking, stress, lack of sleep, just to name a few. When talking about weight loss, we look at calories out from activity and exercise being greater than calories coming in through food and things we drink, essentially anything that has a calorie content. But weight loss is more than that. You know, we have factors that can affect our weight, as we just discussed, hydration, sleep, medications. But in order to lose weight, you do need to burn more calories than you are consuming. So we start with a goal of about 5 to 10% of your total body weight and loss. So if you're overweight, let's say you weigh 250 pounds, a good starting goal would be maybe 10 or 15 pounds of weight loss, but it should be slow and gradual. 1 to 2 pounds a week is considered a safe, sustainable weight loss. Of course, if you are being supervised by your doctor, go by what they say. Getting more sleep can help, helps you get your rest, avoid some of that late night stacking, promotes a healthier diet, and of course, staying hydrated. Being hydrated suppresses your appetite and it does help stimulate your metabolism as well. Remember that small steps make big improvements, which can be true in many of these risk factor areas that we'll be discussing today. As part of our program here at Bronson Cardiac Rehab, we do have a dietitian on staff who you may schedule a one-on-one visit with. It is free of charge to all of our patients, and we can work on weight loss and goal setting for weight loss. So let one of us know if you would like to set up a meeting. Moving on to our next cardiac risk factor area, smoking. Smoking greatly raises your risk for plaque buildup in your arteries, which you can see in this picture here, those fatty deposits. The chemicals and nicotine from smoking can cause the arteries to become smaller. They increases your blood pressure and increases the stickiness of your blood, which can lead to the formation of blood clots. And the plaque can happen not just in the coronary arteries or the heart arteries, but in any artery throughout your body, actually. This reduces blood flow to the heart and increases your heart rate, among the other risks that we just discussed. Important to speak with your doctor today to discuss options for you to help quit smoking. We also have resources here, so reach out to one of us if you would like additional education, resources, or help with this. Diabetes is our next risk factor area that we will be discussing today. Blood sugar control is important with decreasing your risk for heart disease. And one of the benefits of exercise is it can help control blood sugar levels. Are diabetic or taking medications to help control blood sugar, we will check your blood sugar before and after your exercise session. So if you have your own meter, you can use yours or a continuous meter. We also have one on site here that we can use. So we'll make sure that you're within the appropriate ranges before and after exercise. And we do encourage you to measure your blood sugar regularly at home along with exercise, both before and after. So while one of the benefits of exercise is that it can reduce blood sugar levels, you don't want to get to a point where it's dropping too low and you're not feeling well and becoming symptomatic. So we do encourage that constant regulation, watching those levels while you exercise. So looking at blood sugar before exercise, we want that to be above 100. On the flip side, we do want it to be below 300. So higher blood sugar levels over 300 can put more stress on your body during exercise. So you want to know for you personally how you feel when it is dropping lower or when it is high. Let us know if you're feeling that way. We're always going to be checking before and after, but make sure you are aware and that you do know those signs and symptoms for yourself. Next on the list is hypertension or high blood pressure. High blood pressure, also known as hypertension, is an increased force of blood on the artery walls. This extra pressure can damage the arteries. So, blood pressure control, keeping your blood pressure within optimal ranges, can help lower your risk for stroke and heart attack. So, looking at some ways that we can help lower our blood pressure, limiting salt intake, being at a healthy body weight, exercising, quitting smoking, and reducing stress. Exercise actually helps decrease the stiffness of the arteries, so it can therefore reduce your blood pressure. Is a chart of the blood pressure zones. So when I'm talking about optimal blood pressure, normal is less than 120 over 80. And then you can see going further down the list, looking at elevated high blood pressure, stage 1, stage 2, and a hypertensive crisis. Cholesterol's job in the body is actually to help make hormones that aid in your body's function. But as you can see here, there are both bad and good types of cholesterol. So the bad cholesterol, the LDL, think L low, we want that number low, stores cholesterol in the bloodstream. And the good cholesterol, HDL, think of happy high, regulates LDL storage and promotes excretion of it. So when looking at this diagram here, you can see that plaque buildup can happen in the arteries. And when it's too much, it can cause the artery to be blocked of blood flow. Plaque can also break off and cause other blockages sort of downstream from the site that it broke off from, which often leads to heart attack and or stroke. So when your doctor orders a lipid panel to evaluate your blood cholesterol levels, it breaks the cholesterol down into several categories. So total cholesterol is going to be the amount of cholesterol total in the body, both good and bad. Triglycerides are the body's extra fat storage that ends up in the bloodstream to be used for energy. We talked about HDL and LDL. HDL, again, think happy high. This is actually made by your body when you exercise, but it can also be affected by your genetics. So some of the roles that we haven't discussed yet about the HDL is it can help fight inflammation in your body, as well as removing that bad cholesterol out of your body. And then again, low density, think lousy, low. We want less of this to reduce our risk of heart attack and heart disease. Here is a chart that shows normal cholesterol levels. So that total cholesterol, we want it less than 200. The LDL, the one that we want low, we want it less than 100, but oftentimes with a cardiac diagnosis, your doctor may want it under 70. HDL, 40 or higher for men, 50 or higher for women, and triglycerides, total less than 150. So speak to your doctor about getting your cholesterol checked, usually about once a year, sometimes more frequently. And moving on to what can we do to help reduce our blood cholesterol levels? So weight loss, exercise, choosing healthy fats in our diet and getting more fiber. So getting some of those fats from sources like nuts, seeds, fish, oils, and reducing some of the fats that are saturated from processed foods, high fat dairy, animal fat, those types of sources, as well as eating more fiber, fruits, vegetables, whole grains, drinking less alcohol, and taking your medications as they are prescribed by your doctor. Stress, another one of our cardiac risk factor areas. Do have another class that goes specifically into stress management and effects of stress on the cardiovascular system. But stress overall is detrimental to our cardiovascular system and our cardiovascular health. So specific ways to reduce stress are different for every person, but some things you can look at. Exercise helps for some people. Journaling, meditation, deep breathing exercises, hobbies, spending times with loved ones. You just have to look at what works for you and what are your stressors. How can you reduce those? We can't remove every stressor from our life, but we can often influence them. In summary, here are a few quick tips on things you can do to start lowering some of your risk factors. Obviously, it's not limited to this list, but these are just a few examples of things you can try. So eat your fruits and vegetables, limit your screen time, get up and move, get that physical activity, and cut out those sugary drinks. Moving on, we will talk about some specific exercise principles. The FIT principle of exercise is a way to describe the 4 parts of an exercise program. So frequency would be how many times a week you're going to exercise. The intensity is how hard are you exercising, how much speed, how much resistance you're using. Time, how long will each of your exercise sessions last? And type, what will you choose as your mode of exercise? For exercise frequency, or how often you should exercise, for cardiovascular, cardio, aerobic exercise, you want to keep that to 5 to 6 days per week. It's okay to start at 2 to 3 days per week and add a few days on as you build endurance. And for resistance training or weight training, you really want to keep this to every other day. Maybe you get on a schedule of Monday, Wednesday, Friday. But in order to build that muscular strength and endurance, you do need some rest in between. Next, for intensity or how hard you should be exercising, there are a lot of different ways to gauge this, but we'll review some of the ways that we use at cardiac rehab. One of the things we use at cardiac rehab to rate intensity is the RPE scale, so rate of perceived exertion. So this is you telling us your perception of how hard you are working. So this is based on a scale that starts at 6, which would be seated, and goes all the way up to 20, which is the hardest work you could imagine. The talk test is another technique that we use, and it's sort of like it sounds. If you are not able to carry on a conversation during exercise, you're most likely working too hard. So you can combine this with the RPE scale, combine this with watching your heart rate. It's just another tool to gauge where you're at with your exercise. To check your pulse or your heart rate on your own, you can find your pulse on the thumb side of your hand, sort of where the thumb and the base of the wrist meet. Use your pointer finger and your middle finger to find that beat or that pulse, and you're going to count how many beats or pulses you get within 15 seconds. So if you multiply that number by 4, that is your heart rate. At Cardiac Rehab, we will create a target heart rate zone for you. So we will calculate that and develop it based on your needs, your heart rate response at Cardiac Rehab, and your medical history. Using a heart rate zone while you exercise is another way to make sure that you are exercising safely. During your time at Cardiac Rehab, we will track your MET level, which is a metabolic equivalent, or how much work are you doing. An example would be one MET is laying down, staying seated, really not doing anything. And then once you're working, let's say you're working at 3.5 METs, you are working 3.5 times harder than you are at rest. So this MET level helps us decide what activities you'll be able to do without trouble, exercise you safely, and then also track your improvement at cardiac rehab. This chart is just showing some general ideas of exercise intensity using the METs. You can see it goes from light, moderate to vigorous. So looking at longer duration, moderate activity, it can have the same benefits as vigorous activity. So depending on how much you can do, what your baseline is, we'll help you track your MET level. There's an idea that more METs, being able to work at a higher MET level or above 5 METs, as mentioned before, can help preserve your freedom and help foster independence. Each activity has a MET level, as you can see here. On to our next part of the FIT principle, time. As mentioned before, for aerobic exercise or cardiovascular exercise, you want to start with a duration that you can achieve. So even if that's shorter durations of 10 to 15 minutes at a time, you want to eventually work up to accumulate at least that 30 total minutes of exercise. So you can increase your time gradually, maybe every week, every other week. Increase it by 5 minutes or however many minutes you can tolerate. Once you hit that 30, you can achieve up to 45 to 60 minutes for that maximum benefit. And again, as far as resistance training or weight training, you want to start with maybe 10 to 12 repetitions with a lighter weight, 5 minutes at a time, and then you can increase by adding 2 or 3 sets and increase resistance once the activity gets easier. The American Heart Association recommends minimally 150 minutes or more per week of exercise. And the last part of our FIT principle, type. So this again was already mentioned, but what type of exercise can you do? Looking at aerobic activity, walking, cycling, jogging, rowing, dancing, whatever works for you, whatever feels good to you, and whatever you're going to be motivated to do. As far as resistance training, this could look like free weights, machines, resistance bands, even body weight exercises. But improving your muscular strength and endurance for daily activities, this will help you improve your metabolism. It'll help you burn more calories and overall help you be in better cardiovascular shape. We do really just want to promote consistency with your exercise. We want you to continue doing the activity and have the confidence to carry that out, looking at exercise as medicine for life. So there is no, this is the best or that is the best. You find what is the best for you. For weight training, we recommend starting with one set of 8 to 10, 10 to 15 repetitions. You can increase this as your tolerance builds, but a reminder to take those breaks in between. So you want 2 or more non-consecutive days in the week. Working at an RPE of 11 to 15, sort of that moderate to high intensity. And as you can see by this infographic, there are endless benefits to weight training. Improved blood glucose, the ability to improve your immune system function, the list goes on and on. That ends our discussion on the FIT principles of exercise, but we have some other things to take into consideration when you're exercising. Hydration, this is important. Drink water before, during, after exercise. If you do have a fluid limit set by your doctor, keep that in mind and follow that. We encourage you to bring your own water bottle to cardiac rehab. It's a good habit to get into. It's a good habit to stay in, whether you're exercising or not. Weather is another important consideration. So we want to avoid exercise in the heat, the humidity, the cold, whether you're exercising inside or out. We want to stick to the cooler parts of the day, the morning, the late afternoon. Avoid exercise also in the extremely cold weather. That makes your heart work harder. Any questions about that can be directed to cardiac rehab staff or your cardiologist. This concludes the presentation today. Again, any questions, please ask cardiac rehab staff or your cardiologist. If we don't have the answer, we will help you find it. Thank you.